We are your hosts, Nikki Shore and Jesse Swain, and you are listening to the American Journal of Infection Control podcast, Science into Practice, brought to you by the Association for Professionals in Infection Control and Epidemiology to highlight work published in our peer-reviewed journal, ACHIC.
Join us as we speak to those in the field of infection prevention and control, like us, as well as other experts, to learn about some of the latest research in the field and how it can be put into practice. We hope you will listen in, learn something new, and apply this information to your work. If you are not a researcher already, we hope this podcast will get you thinking about areas where you can carry out your own research. Today, we're talking about a paper published in the December issue of AJIC entitled A Simulation Study to Assess Fluid Leakage Through the Glove-Gown Interface. So it deals with that pesky area between the open end of a glove and the sleeve of a gown just underneath. We're pleased to be speaking with Dr. Kilinc-Balci today. Dr. Balci has been working for National Personal Protective Technology Laboratory of the National Institute for Occupational Safety and Health, NIOSH, at the Centers for Disease Control and Prevention as a senior research scientist for over 11 years. She received her PhD in polymer and fiber engineering from Auburn University, where she also worked as a postdoctoral researcher. Before joining CDC, she worked for DuPont as an R&D engineer. She has more than 20 years of experience in PPE, clothing comfort testing and evaluation, fibers, fabrics, and standards regulations. She holds a U.S. patent, co-authored 2 books, 4 book chapters, several manuscripts, and presented webinars. She participated in the development of CDC PPE guidelines in response to the 2014 Ebola outbreak and the COVID-19 pandemic. Dr. Balci has been a member of the World Health Organization Advisory Committee for Innovative PPE and the WHO Technical Advisory Group on PPE for COVID-19. She is also an editorial board member of the Journal of Engineered Fibers and Fabrics for Protective Fibers and Fabrics, and regular reviewer for various journals like AJIC, ITCHY, JOEH, and TRJ. She has worked on several projects funded by CDC, NASA, NTC, USDA, and U.S. Air Force. She is also an active member of technical committees of several organizations, including ISO, ASTM, AAMI, NFPA, AATCC, and TAPPI, where she leads and supports the developments and improvements of technical standards. Welcome, Dr. Balci.
Thank you.
Before we get started, I wanted to ask about AAMI PB70, level 2 and 3 gowns, since the study refers to such gowns. I didn't want to assume that everyone knows the terminology. So, Nikki, can you fill people in on what that means?
Yeah, sure. So AAMI refers to the Association for the Advancement of Medical Instrumentation. AAMI is a nonprofit organization that issues consensus standards for the medical device industry. In the case of this paper, which refers to PB70, this standard relates to liquid barrier performance in the classification of protective apparel in healthcare facilities. Specifically, they're talking about level 2 and 3 isolation gowns. Level 2 is an isolation gown that has a low level of fluid barrier protection that would be used for drawing blood or doing stitches or working with pathogens in a lab. It's slightly more protective than the level 1 gown that's used for basic care. Now, level 3 provides a medium level of fluid barrier protection for things that have a moderate risk of fluid penetration, often from blood splatter, and can be used in the ER, in the ICU, and in critical care units. Does that make sense?
Yeah, absolutely. Thank you. We could do a whole show on that, but let's get to Dr. Kilinc-Balci and the purpose of the paper. First, why don't you set the stage a little bit and tell us what made you and your colleagues decide to write this paper?
As you described, the AAMI PB70 standard classifies gowns according to their strike-through resistance with water or virus, what we also call barrier performance. Barrier performance testing is a crucial part of the gown evaluation, since barrier protection is a critical function of gowns, as well as being one of the most common gown failure areas, as pointed out in the literature. However, AAMI PB70 excludes the interface regions, such as the glove-gown interface, because of the complexity of other factors that affect the barrier performance of this area. Where the glove and gown meet is considered to be one of the most vulnerable points of the healthcare personal protective equipment ensemble, yet there is no established standard test method to quantify the barrier performance at this area. Generally, gown sleeves are constructed to be wide to provide comfort to the wearer. However, when you add gloves, the extra portion of gown sleeve bunches up, which creates channels underneath the cuff of the examination gloves, especially those with extended cuffs. The risk of exposure to arm and wrist areas is even greater when standard cuff exam gloves are used. The cuff of the standard exam gloves barely covers the cuff of the gown and creates not only channels, but also large gaps. Contaminated body fluid may travel through those channels or openings and thereby contaminate the skin of the wearer. This fluid leakage through the glove-gown interface can put both personnel and patients at the risk of transmission of pathogens. That's why we wanted to study the fluid leakage through the glove-gown interface using a test procedure that we recently developed.
So can you set the study up for us just a little bit? I want to know how you went about doing the simulation.
Sure. This test procedure is based on a testing system with a robotic arm, which can simulate healthcare personnel activities in isolation settings. Some of the examples to these movements are shoulder and elbow flexion, abduction, hyperextension, wrist movements such as pronation, supination, ulnar and radial deviation. The testing includes 4 nozzles, equally spaced on the corners. We spray the challenge fluid using those nozzles and aim at the glove-gown interface area. After the completion of spraying and arm and hand movements, we weigh the cotton sleeve that we placed underneath the gown and glove. This gives us the ability to quantify the fluid leakage through the glove-gown interface. In this study, we use 7 commonly used disposable isolation gown models with different cuff types, such as thumb loop, elastic, and knit cuffs. There were 3 gown models without any AAMI PB70 claims, and 2 level 2 and 2 level 3 gown models. We used 2 exam glove models, one with standard and the other one with the extended cuff length. We prepared a challenge fluid using deionized water and a surfactant, which is kind of a soap to reduce the surface tension so that we can simulate the surface tension properties of blood and body fluids. We conducted a series of experiments in which we assessed the amount of fluid leakage in grams as a function of gown AAMI PB70 level, gown cuff type, and glove type.
Wow, that's great. I also noted that you found certain types of gowns that did better in the simulation, specifically in ways that would be likely to prevent contamination to healthcare workers. Can you talk a little about which ones did better and why?
Yeah. Our study demonstrated that fluid leakage through the glove-gown interface depends on multiple factors, including glove cuff length and gown cuff design. For a given AAMI PB70 level, gowns with the thumb loop design provided better protection than those with the elastic cuff design. And the elastic cuff design provided better protection compared to the knit cuff design. As expected, examination gloves with extended cuff length provided better protection than standard cuff gloves in the glove-gown interface area. When a thumb loop design was used, we saw that smaller channels formed when the gloves were donned on top of the gowns. Our previously published studies with other types of gowns and gloves showed that smaller channels are associated with lower fluid leakage values. We made a similar observation for the elastic versus knit cuff designs. However, fabric stiffness, as well as fabric thickness and weight, can also affect the formation of these channels. For a given gown design, we expect to observe larger channels, thereby more fluid leakage, as the thickness and stiffness of the gown fabric increase. And additionally, examination gloves with extended cuff length provided better protection compared to the standard cuff gloves, as the standard glove cuff barely covers the cuff of the gown and creates not only channels but also large gaps with the gown cuffs. Contaminated body fluid may travel through those channels or openings and thereby contaminate the skin of the wearer.
Okay. That's interesting. What kind of recommendations do you have for the future based on your findings?
An interesting observation in the studies was the fluid unexpectedly penetrated through the most of the isolation gown fabrics. Although the fluid exposure was brief, like 5 seconds, and the gown's actual barrier performance aligned with the claimed barrier performance. Our previous test results did not report any fluid penetration through the fabric or strike through, as most of us say, for AAMI PB70 level 4 surgical gowns. When we look at the standard cuff gloves, since there was a visible opening between the glove and gown cuffs, the fluid collected on the undersleeve was partially due to the fabric strike-through and partially due to the leakage through the glove-gown interface. When we looked at the extended cuff gloves with a gown which does not provide superior barrier protection, all of the fluid reaching to the wrist area penetrated through the gown fabric, and there was no fluid left to reach to the glove-gown interface where it could possibly leak through. I think healthcare workers can support the selection process in their workplaces by familiarizing themselves with PPE standards and observing and reporting any issues that they have. Many assume that they are protected from infectious materials when they wear any type of fluid-resistant garment. However, gown fabrics, gown seams, and as shown in the study, the glove-gown interface may provide varying level of protection. Workers should be aware of the protection that they can expect their PPE to provide, as well as its limitations. Our study identifies the need for a standardized method to quantify leakage at the glove-gown interface to improve worker protection. Also, similar to our previous published work in the area, this study underlines that as gowns and gloves are intended to function together, they should be designed as a system in order to minimize or eliminate the fluid leakage through the interface areas.
Thanks so much. I can totally see how most healthcare workers probably don't have the background knowledge to understand, the levels of the PPE that they're using and the limitations, as you mentioned. So that's a great comment to think about.
It's a great way to get staff involved in educating them more on taking personal responsibility for protecting themselves, not putting the onus on them, but giving them the education and the tools to critically think and be able to do that themselves.
Mm-hmm. Absolutely. The other thought that I was thinking as you were finishing up your last comment was that it should be the gown and glove combination should work together. So that's also something interesting to think about for the future. But do you have any closing thoughts that you wanted to leave the listeners with? Any bullet points, takeaways?
As I said, employers and protective equipment users tend to assume that workers are protected from blood, body fluids, and other potentially infectious materials when they wear any type of fluid-resistant garment. However, gowns and glove-gown interfaces may provide varying levels of protection. Employers should conduct a thorough risk assessment first to identify potential exposure routes to blood and body fluids. There are several resources available, including AAMI PB70 and AAMI Technical Information Report, or TIR 11, which is a guidance document on selection and use of protective apparel in healthcare facilities. those purchasing and selecting protective clothing should consider some critical fabric and clothing properties, such as strength properties of fabrics and seams, barrier properties of seams or interfaces, and size of the garments, in addition to the barrier resistance of gown fabrics. If the fabric or seams and barrier layer on the fabric is not durable enough to withstand typical stresses applied during wear or use, such as if the wrong garment size is used, garments may tear during kneeling, reaching, or bending. In addition, garments too large for the wearer may catch or snag on objects. Seams and closures are critical components of the overall barrier protection provided by protective clothing. It is vital to select the appropriate seam configuration to be able to protect from penetration of blood and body fluids. Several seaming techniques are used in construction of protective clothing, including serged or sewn, bound, taped, or ultrasonic welded. Employers should consider the barrier resistance of seams and closures in addition to that of fabrics. American Society of Testing and Materials, or in short, ASTM International, recently published a standards, ASTM F3352, that sets the minimum performance requirements for isolation gown strength properties, including tensile strength, tear resistance, and seam strength. I suggest infection preventionists to get familiar with the standards like AAMI PV70 and ASTM F3352, and possibly participate in the standards development process to help develop new standards or improve the current standards and have their voice heard. Before we close, I would like to acknowledge the co-authors of this study, Drs. Zafer Kahveci and Patrick Gorio. Also, thanks to Christian Copy for the support he provided to the study, and those experts in the field who I consulted with along the way, including Jill Morgan, Jackie Daly, Erin Kyle, Amber Wood, and Wanda Folsom. Last but not least, thanks to the NIOSH National Personal Protective Technology Laboratory leadership for their continuous support and guidance for this study. And of course, thanks to AJIC for this opportunity.
Well, thank you to everybody that worked on this for your expertise. I know that's going to help ease the minds of a lot of bedside healthcare workers, probably bring up a few issues that we've never thought of. So I think it'll help people be a little more mindful of their PPE. So, well, thank you for joining us today. We are Nikki Shore and Jesse Swain, and this is the American Journal of Infection Control podcast, Science into Practice. Thanks for listening and doing your part to prevent infection, because remember, infection prevention is everybody's business. To hear other AJIC podcast episodes and to access information about this podcast in the field of infection prevention and control, go to our website at agicscienceintopractice.org. That's AGIC scienceintopractice.org.
AJIC Science into Practice is created by the Association for Professionals in Infection Control and Epidemiology with input from the APIC Research Committee and Pat Stone and Jean Brandt at AJIC and APIC staff, Lisa Tomlinson, Liz Garman, Bobby Gulshan, Chris Ruiz, Kelly Lynn Russell, Sylvia Quevedo, Kaylee Deaton, and Christine Miller. We work in partnership with Human Factor and audio tech Blake Alton.